Hello, friends. It's Lisa Starr. We have another episode of StarrCast this week, and we're going to talk about something that seems so common. Massage, we know, is the most requested service in any spa almost around the world. A 50-minute or 60-minute Swedish is the most popular. But we're talking today about a specialty within Swedish on maternity massage. And I have a multifaceted expert on the field joining us today, Sparrow Harrington. Sparrow, thank you for joining us.
Thanks so much for having me, Lisa.
Sparrow is joining us from Pasadena. She is the owner and founder of the Sparrow's Nest Massage, which I will elaborate on in a minute. But let me tell you some of the many other things that Sparrow is. She is a pre and perinatal massage therapist. She is an authorized instructor of the Carol Osborne Method for pre and perinatal massage. She is an NCBTMB continuing educator, a certified Mercier therapist. Don't know what that is. I didn't either, but we'll find out. She is a certified educator of infant massage and a former midwifery apprentice. So, needless to say, Sparrow's life has been about maternity massage. Now, why is this important? There are 3.6 million babies born in the US each year. Every day, nearly 10,000 babies are born. And we know that massage is good for the body anyway, but there are many ways it helps during pregnancy, including hormone regulation, calming of swelling, improving nervous system. So I met Sparrow as a client, a consulting client. Sparrow reached out to me for some guidance on creating structure in Sparrow's Nest. I think it's been 2.5 years ago. I mean, listeners know I've worked in the field of spa for many decades. I've managed many massage therapists. I thought I knew about maternity massage until I met Sparrow. And the things you're going to hear are going to amaze you about what can be done that we didn't know about. So again, thanks for joining us, Sparrow, and shining a light on this kind of unseen niche within massage therapy.
Oh, it's my pleasure. It's my passion, and I'm could probably talk about this all day. So
All day.
on track.
Let's start with you, the person, though, Sparrow. I mean, what did you think you were going to do with your life when you left high school? What was the career path that drew you into massage therapy?
Oh, I'm very much an accidental massage therapist. So I was definitely drawn towards the alternative health field for sure, but I thought that I would be entering more in the acupuncturist, traditional Chinese medicine route. And the program that I did for massage was called Asian Healing Arts and Whole Foods Nutrition. So the nutrition component sort of is what drew me in, but the body work was built into the system. And just in the course of actually receiving body work in my own body and learning that I actually had a propensity for giving good massages, it really kind of found a place in my heart. And from there, I thought that I would use what I learned to eventually become a midwife. So I was always drawn towards um, this population,
Mhm.
but yeah, even after becoming a midwifery apprentice. And so I wore two hats in a couple of different birth centers as a staff massage therapist and as a student midwife. And over a little bit of time of being able to kind of straddle both worlds, I actually felt more of purpose and enjoyed the work better and had more work-life balance than I definitely would have had as a midwife. And the rest is history. That was back in 2010. And yeah, I've been doing it ever since. And just love it.
So, when you first started practicing massage with a maternal focus, did you do that on your own or did you work in other places?
When I first started, I was lucky enough to work inside of a birth center, and so I had access to the exact clientele that could use the maternity care, and I was very lucky because sometimes, you can have very good training in maternity massage and then you don't have the opportunity to practice it and to keep your hands practiced and to slowly build your confidence, right? So I was dealing mostly with low risk pregnancies inside of the birth center because that's who, qualifies for midwifery care. But, as my career went on, I have worked with women on the full spectrum of, higher risk, on the full spectrum of bed rest, from women who are on modified bed rest, which means that they can go out for a few hours a day. And, coming in to see me was like one of their favorite times to get up and get out. And then I've worked on the other side of the spectrum with um, very high risk pregnancies inside of the hospital, 24/7 monitoring, and situations where you walk into the room and there's, a calendar up on the wall where they're literally Xing out the days to get to the day that's circled where it's safe for their baby or babies to come into the world.
Can't imagine that. I mean, I've had 2 children and it went pretty straightforward. It's always a dramatic experience and you get such an appreciation for your body
Yeah.
through the act of growing a baby and hatching, shall we say, the baby. But,
Yeah.
that seems like so complicated if you had to have bed rest for days and days before. But I know there are many, many complications, and you have learned a lot about the different ways to deal with those through body treatments, right?
Yes, absolutely. And I mean, massage and nurturing touch can make such a huge difference in those high stress situations. And not just for the mother herself, but you can see it like when I would walk into those hospital rooms, you can see not just the woman herself, but her partner, hopefully, if she has one, the nurses, everybody just kind of exhale for a minute because it's
Mm.
like they know that for the next hour or so, she's going to be transported, she's going to be really well taken care of. She's going to be able to set down, just the constant state of worry that can be a part of a journey like that. So, and usually the results will last for, sometimes it's just a couple of days, but even that couple of days can be such a relief for everyone involved.
For sure, especially in a late stage of pregnancy, you're just never comfortable, so any relief is welcome. So,
Yeah.
in my experience as a manager of spas, I had massage therapists who were, I'm using quotation marks, certified in prenatal or pregnancy massage, we called it back then. And it was like a course that would tell you how to use pillows for side lying. I mean, let me tell you something. Back in the day, we had tables with holes cut out in them
I
so
believe.
women could lay in the prone position. That's how, I mean, it was thought it was okay. That's not done anymore. But my point is that my knowledge of what could be done in pregnancy was limited. I just didn't realize how limited it was. We often did not offer massage to women in the first trimester. No evidence against it, but we just didn't do it. It was sort of not done. And if someone had a pregnancy certification, that meant they knew how to do a sideline and do some support, but it was nothing like as involved as what you found. So, talk to us about when you maybe left the birthing center and had more training with Carol Osborne. How did that all happen? And tell us about that program.
Yeah, so Carol Osborne is my mentor. She has been really the leading figure in the maternity massage movement for about 40 years, I want to say. She's
A long
written
time.
Yeah, she's written a textbook that is used in most places to teach maternity massage. And so yeah, I took Carol's class twice in a row, and then I mentored with her one-on-one for 2 6-month sessions, and then she invited me in to become a teaching assistant in her larger classes, and I did that for a few years, and then in 2018, she invited me and 4 other of her longtime TAs to become authorized instructors of her work, and that process actually took 5 years, so it started in 2018, yeah,
Wow.
and then took us a while to have the skill set, right, to be able to transmit the knowledge because being a good therapist is one thing, which I do feel like I'm a good therapist, but teaching it is a different thing, So she would work with us and to, for example, like you don't want to just show a therapist what you're doing with your body and the intention of the technique, but you also sometimes need to clarify what you're not doing. So the things that often get confused, like when you model something at a table and then you have everyone break up into groups and they go to their tables
Mhm.
and you see a common thread of like, oh, people are misinterpreting what I just said. If you can say it at the table, here's what I am doing, here's what I'm not doing, then that chance of them misinterpreting that goes down by a lot. So, I've just learned so much from her. I'm so grateful to have had her in, my life. I really am standing on the shoulder of a giant, I feel. And the beautiful thing about Carol's approach is that everything is evidence based. And so we are able to really tailor our care towards, centering mother baby versus just kind of fear based liability concerns. And that's not to say that we're haphazard in how we practice, right? We're being very thorough in our intakes, but we can do deep work in pregnancy. In a lot of places, we can do structural work. And so a lot of the teachings are coming from a basis of rhythmic deep tissue sculpting. And so that deep tissue sculpting requires you to stay in the tissue for 30 to 60 seconds as a minimum in order to ask the tissue to actually start to let go and unwind, which is very different than what is happening in most spas where prenatal massage can essentially be, a relaxing oil application. And there is some benefit to the nervous system, of course, of doing that. But for anyone who's in pain, right, anyone who's used to having deeper work done pre-pregnancy, that can be quite frustrating not to be able to receive that. And so really the work that we are doing does create structural changes. It asks the tissue to reorganize itself. And the result is that when a client gets off of the table, they feel and function differently than when they came in.
So you are one of 5 in the United States who are certified to teach this program. And
Yeah.
how long is the program? How many hours is the workshop?
It's 32 hours, and that covers pregnancy, it covers birth preparation, it covers active labor techniques, and postpartum techniques. So, most massage therapists might not be using the active labor techniques, but often, being a massage therapist can be a very easy gateway into doing birth work in general because, you fall in love with your clients, they fall in love with you, and then all of a sudden you're invited to their birth. So we teach it because we want you to have the skills to be able to diversify and adapt your techniques in different
So
situations.
what's that mean exactly? Like you're in the birthing room and you hands-on?
Oh, yeah. Yeah,
Wow.
and I mean, every massage therapist is different, but I can tell you for sure, Lisa, that I have shown up to do house calls that I thought were going to be purely prenatal massage and brought my table only to find that my client's in active labor. And the massage now looks very different where I am following her around. There's no table involved at all. And it has to be very adaptive, right? Because she's moving and I'm watching and timing with contractions and working with her. And so obviously, that's a very, very small percentage of time that happens, but it's really nice to just have that skill set and to be able to adapt. And I would also say that postpartum massage can also be quite adaptive too, because now you have baby on the outside, right? And
Mm,
ideally, we're having at least 60 minutes where we can really put that spotlight on mom, right?
mm.
But mom and baby are a unit, right? There's that mother baby dyad in the very beginning. And so, if a woman hears her baby crying in the other room, she's not going to be able to relax very well. So sometimes it involves us bringing baby onto the table with us and side lying. Sometimes it involves, you know, having her in semi reclining so she can nurse. And usually I personally, and have all of my therapists save the feet work for a moment like that. So that way, if she's sitting up and nursing, we can still be doing some therapeutic work, but we're kind of giving her some space, right? And, we can reflexively help the whole body through the reflex zones on the feet. So things like that. It can be quite adaptive if when needed.
Amazing. So, Sparrow, the most perfect scenario would be that a client comes to you at what point in pregnancy and then continues? Like, what would that cadence look like?
Well, I'm glad you asked, Lisa, because, there is this, you were talking about, the cutout tables or the myths that you can't work in first trimester, but I still see it happening, So, um, ideally, yeah, we would be starting in first trimester. And the research tells us that pregnancy stress actually decreases over the course of a pregnancy. And so that means that first trimester can often be the most stressful time for a woman. And there's so much going on that is completely unseen and unacknowledged, right? Because it's not obvious that someone is pregnant. Women can often find themselves in a state of limbo where no one will really acknowledge that they need any care or that anything significant has changed in their life. including sometimes OBs. Sometimes OBs will say, come back when you're like 9 weeks and then we can
Mhm.
acknowledge you. So sometimes there's several weeks, right, where women are sort of floating, where no one will take them in. Spas certainly won't take them in. And so the only thing that we don't do in first trimester is abdominal work. But we can work on a lot of pre-existing pregnancy holding patterns, which are great to do before they are compounded by, the extra weight and the extra laxity and the extra fluid that comes with pregnancy. So it's a great time to do that. It's also a wonderful time just to help reduce nervous system stress, which oftentimes, not always, but oftentimes can also help with nausea.
Mm.
And really just to hold her in a space where she's being acknowledged that something significant has shifted in her life. And so I will often, even in first trimester, put clients in sideline because you're essentially putting someone into a fetal position, which is conveying a sense of safety, a sense of deep breath, relaxation to their entire nervous system. And you don't miss out on anything. We can access the entire body in sideline. And you've seen the system in person, Lisa,
Mm.
but we're not just talking about giving someone, a body pillow to hang on to. We're talking about a system that supports, beautifully under the neck so that all of this is filled in. We have a torso pillow so that they're lifting the torso up off of the table so that their shoulder has a space to go into. They're not crushed on
Mhm.
top of it. And then we're getting enough pillows underneath the knee so that the hip, knee, and ankle are in alignment and perpendicular to the ceiling. And that makes a huge difference. So we have clients, once we get them all set up, that will tell us, oh my gosh, this is the most comfortable
Mhm.
I've been my whole pregnancy. And we haven't even started the session yet.
Amazing. So you're okay with first trimester work. And how often would you recommend would be ideal for someone to continue with this type of massage through their pregnancy?
So we like to have everyone come in every 2 weeks up until
Mhm.
about 34, 35 weeks. And then we recommend a weekly cadence from there
Mhm.
until birth.
And it's probably not that often that many clients can commit to that, but what kind of results do you see when they have? Like what difference does it make in the body and maybe for the birth practice?
Well, it can vary person to person for sure. But what we hear a lot is just that they have found a sanctuary, really, not only to let go of physical holding and pain, but to be seen and heard because most women are receiving kind of standard obstetrical care, which usually involves about a 15-minute appointment.
Mm.
And there's not a whole lot that
The massage is going on.
no massages going on. And again, it doesn't mean that, we're answering questions outside of our scope or anything like that, but sometimes just really being a listening, kind,
Mm.
ear makes a huge difference in how someone navigates their entire pregnancy. So, lower stress, easier time getting to sleep, staying asleep, reduced pain, an increased kinesthetic awareness, which is just a fancy way, right, of just saying knowing where your body is in space and time. I also think that those regular touch points give women a chance to articulate what their needs are, what they're experiencing in their body, what their needs are for that particular week, because clearly, like, we're on a journey with them. Week to week changes quite a bit. And having someone listen to them and attend to those needs, I think, can be psychologically very reassuring. Many women feel a increased sense of confidence going into their birth process, the work
That,
that we do together.
especially your first time, feeling confident is so important in this process. Well, it is amazing that you are there to provide that support. I mean, I never knew as an industry expert, I just didn't know there were people that had this level of training. I know that at Sparrow's Nest, you have a variety of massages. I mean, your standard maternity massage, but you have induction massage. Like, could you tell us about that?
Yes. Yeah. So we have induction massage and we also have some specialty postpartum sessions as well, including lactation work, C-section scar work, and we also offer bereavement massage for anyone who has lost a pregnancy or an infant. And yeah, those are usually things that are pretty untouched outside of the spa, world, but it's something that I have found to be both very needed and very fulfilling as a therapist. And so in regards to induction work, I always tell my therapist, in a perfect world, I would have no need to be doing induction work, right? This is really in response to the narrowing, I think, of what do I want to say, of parameters that women are allowed to have leading up to their birth. And what I mean is that, even since 2010, I have seen a narrowing of what is allowable by the medical establishment. So, for example, when I first started, breech births and twin births were allowed to be attended by midwives at home. That is no longer true. Breech births and twin births are almost exclusively automatic C-section, not because the babies can't be born vaginally. I mean, we have since the beginning of time, but mostly because the newer OBs are being trained first and foremost as surgeons, and they're losing some of their hands-on skills to handle those situations vaginally. I'm also seeing, we're also seeing a trend towards earlier and earlier inductions, even in low risk healthy pregnancies. And so when you combine all of those things, I actually felt like we were more of service to the women that we are working with by offering induction work. And again, like in a perfect world, I would say let the baby come when the baby wants to come. But when you have clients who are being told, no, I have to be induced at 39 weeks, right? And 40 weeks is when we
Normal
designated to be.
gestation.
Yeah. And, 40 weeks is an average. That means usually half women will birth before 40 weeks and half will birth after. And so if you're in that like second half where your body or your genetics or whatever, this particular baby would have hung out for 42 weeks and that you're being asked to go into labor at 39 weeks, that's a big ask
Mm.
of the baby in the body. And so we do offer induction massage really for that reason. It's more of a cultural response, or a political
Mhm.
response to the conditions that, yeah, our
Or
clients are.
maybe sometimes the client is just ready. I mean, they're at their 40th week and they're just like, "I want to have this baby."
I mean, yes, except that, there is a whole hormonal cascade. There is a conversation that happens between the mother and the baby's body. And usually it's the last touches that are happening on the baby's lungs that signify to the mother's body, let's go into labor now. And so sometimes feeling done does not constitute actually being done. So, but
Sure.
I'm like, let's make you comfortable, right? In
Mhm.
these last, bits of time, because a baby who is fully ready is also going to transition into the world much easier, and you're going to have an easier postpartum, with a baby who is, more fully ready to be outside of the womb.
So when you and your staff perform induction massages, do you focus on certain areas to bring about the labor? Is that how it works?
Yes, so we focus on a couple of things. Part of it is going to be just nervous system sedation, and then the other big part of it is doing sustained bone to bone pressure on some of the acupressure points that we would be specifically avoiding up until that time.
Mm,
Yeah,
okay.
and to be honest, Lisa, I can't even tell you. We've been doing this for about 10 years. From what we've seen, anyone who comes in at 40 weeks or more will go into labor within 48 hours, about 80% of them. So it's not, there's no magic button. We cannot force the body to do something that it's not ready to do. But if they're close, it does tend to kind of tip them towards labor.
Sure.
And I still can't tell you if it's because of those points or if it's because we get the nervous system into a state where it feels safe enough to do the thing that it
Mhm.
already wants to do.
Yeah, that's a great distinction, Sparrow. And I think, I mean, even just the mental part of you're like ready and now you've had this treatment and you feel like, okay, I'm more present, I'm more ready now to do this thing, as you said, this monumental thing that our bodies do is amazing. I know that you have a home care house call network and you do plenty of these. People want someone to come to their house and perform an induction massage. And I know that they're often, the baby is born pretty quickly after, as you say. So who knows why, but it can't hurt.
No, it
Um,
can't hurt. Yeah. It's
and
usually a
then
very relaxing
postpartum, like
experience.
how quickly do you want to see someone postpartum?
That can be there can be a variety of answers. I mean, really it's like when a woman feels like she has capacity for it. So, sometimes I see clients like the day after, and ideally we're seeing them the day after with a house call, not with them coming into the office, but sometimes people feel sometimes people make their way into the office and, we'll support them however they need. The people who, excuse me, that we see early on, those are going to be, the uncomplicated vaginal births, right?
Mhm.
We can also see clients like pretty soon after post C-section, and there can be a lot of great benefit to helping to move some of that fluid, which can be so uncomfortable. But we generally ask for medical clearance to do that kind of work. And then once someone is, 6 weeks or more, they can come in for regular care. And in terms of doing scar work on the C-section scar, because there are 7 layers that were cut through and that are healing, we need to wait until 8 to 10 weeks to work directly
Mhm.
on the scar itself, because even a scar that looks healed may not be fully healed on those deeper layers. So we need to give it enough time to solidify.
And you do specific work on the scar to promote the healing?
Not just to promote the healing, but really it's more of a functional piece because, so again, there's those 7 layers, right? And all of those 7 layers are meant to operate and move past one another independently, and when they all get cut through, they have a tendency to glue together.
Mm.
And so that can cause issues that range from, something as little as, I can't stretch my arms above my head as
Mhm.
much as I used to, right? Because it's pulling in that scar tissue, all the way to having mysterious long-standing back and pelvic pain to incontinence to difficulty with conceiving. Again, sometimes there's secondary fertility issues. There can be pain with intercourse. So it can very much interrupt, the quality of life on that more severe end of the spectrum. And that can become more true if someone has had more than one C-section, which is
Mm.
not uncommon, right? Because
Right.
in our culture right now, it's
Mhm.
usually once a C-section, always a C-section. Again, not always evidence-based, but that's how it's practiced. And so if you have all of these 7 layers that are all cut through and then they heal, and then you do it again or potentially again, right? Then some of those larger consequences is just more and more layers of scar tissue. So we are really thinking about how can we free that up. This is a lot of myofascial work. It's not painful, but it's also not always comfortable, especially at the beginning. So because we're really asking the tissue to separate itself, it can feel hot. We're bringing lots of circulation to the scar. It can feel like low level burning, ripping, tearing, which sounds
Mhm.
terrible, but sometimes
Mhm.
when I let my clients know that that's what they're gonna be experiencing, but below the threshold of pain, it's just sort of like,
Mhm.
this doesn't feel
Uncomfortable, but not
comfortable.
painful.
Yes. But if they know that going in and they know that that sensation equates to freedom, then all of a
Mhm.
sudden they can, like, really relax and be like, "Ooh, yeah, that's great. I can feel
Good.
that we're really getting to where we wanna go."
How about lactation massage?
Yeah, lactation work. So yeah, talk about another stressful topic for
Mhm.
moms, worrying about being able to produce enough milk, worrying about, yeah, avoiding mastitis, which, if you're not
Mhm.
familiar with, is a breast infection that not only is quite painful in the localized area, but actually causes like a systemic, like flu like scenario where you have a fever, you have body aches, you have chills, like you feel awful. So, and then trying to, care for a newborn 24/7 with that going on is not ideal, right? And so we started to offer lactation work to, yeah, just help with generalized breast health and hope, with the idea of it being preventative. So if anyone is like prone to clogged ducts, we can help clear them. If anyone has low milk supply, this usually will help stimulate milk supply. And we also like try and do a little bit of coaching and encouraging to make sure mom is actually resting enough and eating enough calories, because breastfeeding takes more calories than pregnancy itself. And we forget that. And we're in a little bit of like a bounce back culture where everyone wants to lose the baby weight so fast, but sometimes it's at the expense of other things. And so, the massage work is very, very helpful, and it's going to be the most beneficial when it is paired with these other components of like deeply nutritious food and rest.
So many detailed components to it that you just don't know about, but obviously you're an expert in this field and you speak so eloquently about it. And, I've seen firsthand the work that you do and the results that you get and the many, many happy clients that are helped by Sparrow's Nest in Pasadena for sure. I'd like to dive into the business side of it,
Sure.
Sparrow. And when did you decide to open a place on your own? And was there resistance, to that idea or people saying, "What, you only do this one thing?" How did that work for you?
No, and we've always also offered therapeutic massage, but it is such a small part of what we do now. I
Mhm.
think like in 2025, our therapeutic sessions ended up being like 3% of our
Right.
clients. So we very much do. I mean, sometimes even the postpartum work, it can be more long-term postpartum.
Mhm.
You're seeing clients, 1 year, 2 years after having a baby, but then oftentimes they'll get pregnant again and they'll be
Mhm.
back into the flow. Yeah, when did I decide to do it on my own? Well, I think that there were just things within um the environment that I was working in that didn't meet my standards, I guess. And I really wanted to have certain things the way that I wanted my clients to experience them. And it kind of made me, yeah, like hungry to go out and find that and create that. But it was certainly scary and it certainly happened in little baby steps. I mean, we've grown now to a good sized team, but it's been slow progress. Like I have not been someone who has like exploded in growth. Like it's just been slow and steady. And that has felt okay for my nervous system and honestly like my business knowledge too, because I was just a practitioner. I was doing all the work, right? And then learning how to slowly learning the struggles of trying to run a business from inside of a treatment room, right?
Very
And how
challenging.
not sustainable that can be. I had to learn that over time. And now I'm almost not in the treatment room at all unless I'm going in to cover, but I'm mostly of service to the business by training the therapist.
Mhm.
That's still really fulfilling and great. But yeah, I definitely still feel like there's a need for this work. And, even if there are like massage therapists listening to this who, maybe you don't know a lot about C-section scar work or lactation work or whatever, even being able to safely position your client correctly and just doing, the work that you do know how to do, I think in many ways can be so beneficial to these clients. And,
Mm.
it's not that I'm deterring anyone from, diving deeper into this work, but I also think that there is a lot of benefit even in like the more simplistic approaches to just therapeutic touch and being someone who cares for mothers and new families during this time. It's really profound. And they remember you.
Oh, I'm sure you've played a huge part in their lives. I mean, I've been at your place where there's notes on the wall and pictures of baby, and you become another member of the care team through that amazing life experience of having a baby, which is really cool.
Yeah.
So, I think that we should talk about Mercier Therapy because
Oh,
that's
sure.
something you offer that I had never heard of, and it's quite amazing. Please explain what Mercier Therapy is and how you use it.
So, Mercy therapy is what they call a deep gynovisceral massage of the uterus and ovaries and the surrounding ligaments. And it is primarily used for fertility support. It's a holistic method of bringing a tremendous amount of blood flow to the pelvis and specifically the ovaries and the uterus. It is a 360-degree therapy, which means we work on the front, side, and back of the pelvis to make sure that everything is balanced and aligned. And it's comes in a series of 6 hours of treatment. Normally, that's broken down once a week for 6 consecutive weeks. And the benefits of that work go on to influence about 12 months of future cycles. So it's pretty profound work. It has an 83% success rate of women conceiving within a year of receiving the full series. Most of our clients are conceiving earlier than that, often around like that 4 month mark because
Mm.
it impacts future menstrual cycles and enhances the egg quality and all of that. And really the stimulation of the ovaries enhances how the ovaries and the pituitary are communicating with one another. And so that's where we see a lot of the benefits to the menstrual cycle coming into play over time. Yeah.
So this is a different certification and a different training in addition to
Yes.
your normal massage work.
Yes, and this is not something that I teach. This was created and founded by Dr. Jennifer Mercier, and she's the only one that teaches her work, and she is in St. Charles, Illinois. So if anyone is interested in studying with her,
Mhm.
she's lovely and her method is amazing. She came up with it because she had stage 4 endometriosis and was told that she would not be able to conceive on her own. And she figured out, this therapy, taught it to a couple of her students, they did it on her, and she went on to have 2 healthy babies.
Okay.
Yeah.
How many hours is Mercier training?
I believe it's around 30 hours right now.
Mhm.
Yeah, and then there are some, like, additional mentoring that you can do because, there's the hands-on component of it, but then there's all of the not just menstrual cycle knowledge, but also reproductive technology, what do I want to say, landscape that you want to be able to speak to because lots of times we are not just working with clients who are hoping to avoid that, but sometimes we have clients who are already committed to that path. And so we're helping to kind of prime the body in order to have a successful, either egg retrieval or embryo transfer or something like that. So we want to really know where they are in that process. We want to know, what medications I might be taking and be able to tailor our hands-on work based on, yeah, what's going on with
Well,
their individual journey.
I'm fortunate to be a fly on the wall on your inter-office chat log, and I think I saw a week or 2 ago that a 52-year-old woman had conceived after having Mercier with you and your team.
Yes, and this is, I mean, yeah, this is from a egg retrieval from when she was younger, but yes, it's just
Amazing. It's just amazing work, what you're doing. Let's talk about the clients. I mean, because you have this whole practice, 97% in some stage of pregnancy, right? I mean, people getting massage are already a little shy sometimes to put their body out for a stranger, and now you have the added layers of fear and whatever anticipation of pregnancy. I mean, does it make it complicated as an owner or manager to run a practice where everyone is in some stage of pregnancy and then a lot of your staff too, as it turned out this year?
yeah, especially this year, yeah, including me, my goodness. Does it make it difficult? I I guess because we've grown into it so slowly and
Mhm,
it's just if it's like you don't see the water that you're in, I suppose that
mhm.
not really. I do think that it takes, as a therapist, this type of work you have to really be attuned to your clients. Like you can't really get away with kind of doing choreographed work. You can't really get away with, letting your mind kind of check out in sessions. And, for some therapists that might be a con, but for the therapists that work with us, like it's such an interesting and yeah, just deeply meaningful place to work and population to serve that yeah, everyone who is attracted to our work just feels really excited to be doing that work and can really turn that on and can really hold that space for our clients. And our clients feel it. And so, you know, we do definitely do a lot of training around how we speak to clients, not only just with the therapist of what's going on behind closed doors in the treatment rooms, but also with our front desk because you can it's such a vulnerable time, it's such a sensitive time, right? Like how we speak about breastfeeding, how we speak about, pregnancy or body size or, whatever. You have to be very, very thoughtful in how you do that because things can land just harder than they would in a different stage of life. So I guess those are some of the challenges, but it also feels like so integrated and so normal for us, and we get to practice it all the time that it's like we don't forget it, you know?
Mhm. You have a lovely retail shop in your
Oh, thank
space.
you.
Can you talk to us about the evolution of that and the kinds of items that you sell? I mean, because some of them are quite popular.
Yeah, I mean, I feel like, the thing that moves the most right now is the magnesium cream, and we
Hmm.
use it in some of the sessions too. And it's just sometimes our clients will take that home and, put it on the bottoms of their feet before they go to sleep. And it's just been very helpful
What does
for,
it do? What does the magnesium cream do on the bottom of your feet?
well, increasing magnesium can just help, relax the whole body. And some of them are unscented and some of them have, like, a very nice, relaxing, soothing scent depending on, a client's preference, and so that's been really nice to have. It's great for calf cramps, which come up in pregnancy, and,
Mhm.
those are things that can actually wake you up in the middle of the night, like, if you're just moving, you're just trying to switch sides and all of a sudden your calf, like, locks up on you, so, putting that on at night can also help prevent that from happening. The lower legs are working a lot harder in pregnancy because the core of the body, the abdomen is so much softer and so much more relaxed, and so some of those smaller muscles are working overtime, and, yeah, magnesium cream can be very helpful for helping, the body relax and to have a good night's sleep. But yeah, there's lots of stuff in the retail space. I mean, everything from like little mama necklaces to, organic robes and slippers to a wedge pillow to help support, the
Mhm.
underside of the belly while a mama is sleeping, to beautiful cards for all different seasons of life. Lots of skincare products. We carry the Laurel line of skincare products for our, holistic skincare treatments as well, and, we love that line. But yeah, all kinds of things, belly balms,
Castor oil packs.
castor oil packs, yeah, that can be great not only for fertility, but also for C-section scar
Mm.
work as well to help the scar start to soften all of those layers. Yeah, so there's all kinds of stuff there.
No,
Teas,
it's a
yeah,
lovely little boutique for all things, maternal. You've done a very nice job with that. So
yeah.
the latest change in the business, Sparrow, has been, I think, that you as an owner stood back and noticed that people were coming too late in their pregnancy. They would find you in their seventh month or eighth month and not really get the benefit. And you came up with a new system of grouping things together and to kind of get people on board sooner and for longer. So, could you share a little bit about how that all worked for you? How you came up with the idea and what the results have been?
Sure. Yeah. And really, so much of the changes that I've made over the years have just been from listening to clients, right? Which is how we
Mhm.
the fertility work or how we got, motivated to do the lactation work. And for this, we just kept hearing over and over, gosh, I wish I had found you guys sooner, And there can be this preconception that massage during pregnancy is this special sort of one-time treat. And so sometimes women will wait until the very end. And so, yes, this idea that I came up with of care plans is really trying to speak to what we can achieve over the course of a whole pregnancy with regular touch points. And I sort of equate it to, if you go to the gym one time and have like a really good workout, that doesn't mean that it's going to change your whole physique, right? In one day. But if
Very
you have
true.
regular touch points, right? There's a lot that we can do. And so that nervous system relaxation, that increased circulation to baby, that's what will actually improve pregnancy outcomes, right? To be able to have your mother's nervous system regularly get into that state of deep relaxation and safety. The body knows how to do all kinds of amazing things in that state. And most of the scariest things that can happen in pregnancy are all stress related. So if we can reduce stress and have those regular touch points, and we know that massage does wonders in reducing stress, that's what can really help improve pregnancies. So that was the idea, and then, yeah, it was just really fun to sort of create different care plans. So we have ones that start in first trimester that carry you all the way through, some that start around 20 weeks, some that start in, right around third trimester, like around 28 weeks, and then we have the metamorphosis, which is that in like birth prep intensive, which starts around 35 weeks, and then you have weekly touch points until birth. All of the care plans can transfer over to postpartum in case baby comes a little early.
Mm.
We packed in some fun little perks so people get a wallet credit to shop in the boutique. We curated this beautiful birth playlist, so any of the birth care plans, they'll have that waiting for them. And we also gave everyone access to a course that I made. It's a digital self-paced course called Body Full of Grace, and it just shows you a bunch of different ways to alleviate pregnancy pain at home. So in between sessions, you can be doing things just to make sure that you're staying comfortable and feeling in touch with your body throughout the pregnancy. So this whole idea is fairly new, but so far we've seen about a 20% increase in the longevity of like client lifespan just from introducing those. I expect it to continue to grow. And it's not just about, increasing, the lifetime value of clients, which is, business wise really important because
Of course.
constantly having to bring in new clients is,
That's
is
the
tough,
thing, right? They're
expensive,
pregnant and then they're not,
right?
right?
So of course there's like the business reason to do it, but then I've also just seen just a huge increase in satisfaction within my team who don't have to constantly reintroduce themselves to brand new people every day, but who get to really be on a journey with these clients who are coming on a regular basis and then leading up to birth and we get to celebrate that with them. Sometimes the babies are coming in after we get to meet them. It's very, very sweet and fulfilling.
Well, I think it's really genius of you. You're very intuitive on so many levels, and you saw this need and you created a way to address it. And sort of changing the mindset around, like you said, the massage during pregnancy should not be like this one shot deal that you got. That's nice. There's nothing wrong with it, but it's not going to really make a big difference in the long term the way regular care can. And you and your team see the results of those regular visits. I mean, happy, healthy moms and babies is what we're after. What what do you think that traditional spas should do, Sparrow? Hotel spas, day spas, when they get pregnant clients? I mean, what would be the best way to treat them, given that they have a much more limited knowledge than yourself or people on your team?
Yeah, that's a great question. And I've done some trainings with some spas that, that just have different limitations, right? They have limitations on what their turnover time is, what their intake process is like. They might be going into a session and have much less information about that client or that guest than we do. Our intake forms, we come in with all kinds of information to tailor a session. So I would say, for spas and hotels, probably just really focusing on positioning would be huge because like I said, you can have clients who once you get them properly positioned, they will literally tell you this is the most comfortable I have felt in my
Mm.
pregnancy and you haven't even done anything yet, right? And then yeah, I do think it's worth investing in some of the bolstering systems. So in my practice we use the Oakwork side lying positioning system. You don't have to use that. You can recreate a similar structure with enough pillows. It's usually about 6 pillows, so making sure that you have enough equipment for your massage therapist to use is really important, but the difference in using pillows versus using this bolstering system is it makes a big difference in how sturdy a client feels.
Mm.
And they're not gonna sink over time into those pillows because the pregnant body is malleable, it's supposed to be malleable, and so, you can have clients that just sort of, like, start to sink and collapse, over time. So really getting enough bolstering, I think, would be a huge piece, and would be an easy, like, low-hanging fruit to pick to make sure that your clients are really very comfortable. It wouldn't take away from you having to extend session times much. Like you can get really fast at this. You can set up the pillows in, under a minute, like 30
Mm.
seconds with practice. Like
Yeah.
my team can do it real fast.
Yeah.
So it can be done. And I think that that would be a really great starting point. And you could consider sending some of your team to study with any one of us that teach
Mhm.
this work because sometimes all it takes is one person on the team who is not afraid and who is actually excited
Mm.
to work with your pregnant clientele that it becomes contagious, right? Because I have also seen that in the spa field of like there are some therapists that like, I don't want anything to do with
Uh-huh.
pregnancy. And that attitude can also be contagious amongst
Mm.
your staff, right? So even if you couldn't send your whole team, if you send, a few, um, and they come back with this sense of uh of the work and an excitement to work with this population, I feel like that can also be contagious.
For sure, that's well put. I mean, to a therapist who might be listening, how do you know if a niche like this is right for you?
Well, maybe I was gonna say, if you don't feel like called right to it, maybe listening to somebody like me who's just so passionate about it, and if it sparks anything in you, I think it could be worth exploring a little bit and maybe extending yourself to someone in your life who is pregnant and seeing what it actually feels like to be a part of her journey and seeing if you get that secondhand oxytocin hit because
Mhm,
that's what we get a lot in this work. And like I said, we do bereavement work as well, so it's not always happy endings, but
mhm,
it's vastly in terms of the proportions, it's way more happy endings than not, and even when we're doing some of the bereavement work, it's still deeply meaningful work, like, you really feel like you made a difference in someone's life, and so, I would say try it, like, try and work with somebody close to you and, you can let them know that maybe you're not, perfect at this yet or anything, but, see how it feels for you, see how it feels for them, see what the feedback is like, and I would bet that there's more oxytocin than you might be
mhm.
expecting
It does
from.
seem like an opportunity to touch someone in a much deeper and more meaningful way. I mean, notwithstanding normal massage is wonderful and people love it, but this is something much more profound, really, to be able to be a part of that process. For an owner who might be listening or a manager, like, and you want to expand, what would you say might be something to avoid when trying to build a specialty focused practice like yours?
Something to avoid.
Anything that was a surprise to you, about this when you now that you can look back and say that you hadn't anticipated some of the challenges?
I feel like there was probably so many surprises, and I'm trying to think of.
I know one challenge for you is staffing, because not only
Yeah.
do you need certified massage therapists, they have to be specially trained. And, you can't just hire one this weekend. I mean, the process is long to become trained and competent at this work. Had you anticipated that when you started to expand your staff?
No, I think you're right. That was definitely more of a learning curve for me. And I do think that it's worth it, to invest in these therapists and to create a structure where they want to stay and they can see themselves growing and reaching their own goals within, your organization because yeah, if you have too high of a turnover in a niche specialty like this,
Mhm.
it can really burn you out because there's a huge amount of like front and investment in each person. So that's a great one, Lisa. Yeah,
Mhm.
to speak to.
And it's a challenge to the timing. These appointments take more time. That we're not turning these rooms on the hour. And
Mm-mm.
so you need enough resources to make the business model work. You have 5 treatment rooms, correct?
Mhm. Yeah,
And,
5.
uh, and a retail room and a nice waiting lounge, but having those 5 rooms working is a challenge to get the timing right and
Yeah,
align it with the capabilities of the staff who can really only do 2 or 3 appointments per day when they have this specialty. That's what we see.
uh, so the minimum that our staff will do is 3 in a
Mhm.
4-hour shift, and then the most that they'll do is 6 in an 8-hour shift. Yeah.
But the number of people that can do that is not the whole team, correct?
No.
Yeah. So you need to think about that as you go into this and you're deploying your resources of like having enough people to fill up that schedule. And then, of course, there's the issue of finding clients. I mean, what has worked for you, Sparrow, and building Sparrow's Nest and having people find you with this extreme specialty that you have?
Yeah, well, that has definitely changed over the years because it was all word of mouth at the beginning.
Mhm.
I mean, it was just me at the beginning, and yeah, people would just tell people, and that worked really well. And again, like I was in a good place of working inside of the birth center, so I had access to my ideal clientele and got lots of practice and could keep my hands working. But then, yeah, once the team started to grow, and now I'm trying to market for, 10 plus massage therapists, I've definitely gone down the meta ads route, with
Mhm.
specialized ads. And actually that has been helpful. A lot of people have found us that way. So yeah, and then it's a matter of like once they come in, then
It just
they'll tell me
seems like it
friends.
takes one visit, and from the comments that I see, and the clients are completely hooked, and why wouldn't they be? I mean, it's purpose built for this specific position they find themselves in of being pregnant, and it's this amazing support for that. But, you do have to get the word out, even in a big city like Greater Los Angeles, and you've got plenty of pregnant ladies there.
Yeah, it's still, we have not like hit our full capacity of the space yet. So there's still room for growth, and I still have, things that I can, do better as an owner. And so there's still a learning curve. But I mean, we're doing better than we've ever done, growth is headed in the right direction. Yeah, I'm learning better how to hire, how to train, how to retain my staff and the clients. And so yeah, I feel like little by little it's slow and steady growth, and it feels sustainable, which is nice too. Cause I know that you can sometimes become, a victim of your own ambition or of, a growth rate that feels really harsh. And
Mhm.
so I'm I do want to keep growing and continuing to serve and eventually have more locations, but I'm okay with it, getting there and getting the blueprint down right before we think about, yeah, more than
In
one.
terms of marketing, I know that you have had some celebrity clients from time to time, as you would expect. You mean you're in Pasadena, you have many famous people around you. Has that worked for you? Do they allow you to say that they've been there? I'm sure it's effective if they do.
I mean, yes, and it is interesting, right? To because it's like like I said, I'm standing on the shoulders of Carol Osborne, right? You would think that that would speak for itself, but oftentimes people don't care as much about that as they
Mhm.
care about, well, so and so went there, right? So that social proof is powerful. And yeah, I've worked with many celebrities over the years, and some, have been gracious enough to allow me to share some of their experience or to say that we've worked together, and others we've signed NDAs, right,
Mhm.
where it's completely like their private life, which I completely respect, and so it can vary quite a bit,
Mhm.
And it's, motherhood and postpartum and all that, it's very vulnerable, so I do understand why some of the celebrity clients really wanna keep that private and
Sure.
protect. Yeah.
Absolutely. So, in closing, Sparrow, what would you say this path has taught you personally and or professionally? Is what you're doing now what you expected to be doing, and how has that light that shines from you, guided your path?
Well, Lisa, I'm a mom now, so I have 2 little ones and a third on the way, and I do feel like the growth that we have had has allowed me to, yeah, be with my kids quite a bit more than maybe I would have if I was just in a treatment room, all day, every day. I do feel that entrepreneurship requires a certain level of self-development. It's constantly asking that of you, and so I have felt that I've had to mature and I've had to learn new skills, every year, and thank goodness for people like you who I can reach out to so that I don't have to learn everything from scratch, and you have helped me navigate some of the pitfalls because again, like I'm not coming from a business background, like I'm coming
Right, of
from
course
a
not.
retreat background, right? And so yeah, not having to learn, I guess, from scratch and from making every mistake in the book has been very, very helpful. And yeah, it's beautiful to see this grow beyond me. It's sometimes a little hard, right? Because sometimes it's the owner that can be the bottleneck, right? If you
Mhm.
want to have your hand in too many things. And so it does take some trust in your team, and to see them take off and to do it without you is it's a little bit bittersweet sometimes, but I'm
Mhm.
getting more used to it. Yeah.
Like having kids, and you
Yeah.
raise them and then they grow up and leave, and that's our job, is to make them be able to function on their own, but I'm sure, as you say, it's a little bittersweet.
Yeah.
But you realize that the scalability of one person is limited, so
And
and there's
I don't
such a
wanna be
need.
the reason I don't wanna be the reason that this care isn't more accessible
Mhm.
to more families because I'm trying to hold on too tight, you know?
Yeah. Well, it's wonderful what you're doing, Sparrow, and thank you so much for joining us and telling this story. When I've watched you over the past 2.5 years, what you've built and what you do, and it's just from the heart and so earnest and true, and I just really respect it. And I thought people should know this is happening because even as I say, a decades-long veteran of the industry, I didn't know this kind of special focus existed. So thank you for shining a light on this for us at StarrCast Podcast. And thank you, Sparrow Harrington. If you want to learn more about Sparrow, you can find sparrowmassage.com. You can find her on LinkedIn. If you're a massage therapist listening and you have any call to this work, you would do well to attend one of her courses. And thank you again for joining us.
Thank you so much for having me, Lisa, and for everything that you've helped me build. Really
My
appreciate
pleasure.